Hey everyone, Alex here from Rowan Health and Wellness. Today I want to talk about the sunshine vitamin, which is vitamin D. Are you getting enough? And are you getting enough year round, especially if you're up here in the Northern Hemisphere? And how that might actually be affecting your health. So, vitamin D is actually more than you might think. Just in recent years, a lot of talk has kind of been happening around vitamin D and its importance to bones and how it helps regulate calcium and phosphorus in our blood so that the calcium and phosphorus go into the right place to help build our bones. But it does so much more. Just so much more. It helps control, it's been shown to help control cell growth, which is important both for if our cells are not growing fast enough, but also if they're growing too fast in the case of something like cancer. Neuromuscular functioning, that communication between your nerve and your muscles. Lots of conditions with those might actually be improved with something like vitamin D supplementation. Looking at immune function, your body's ability to fight infections as well as your body's ability to reduce inflammation, which really does go down to the driving force of a lot of diseases we're seeing these days. So some of the kind of key things that vitamin D has been linked to now with new research and evidence coming out through scientific studies, things like prevention and management of diabetes, coronary artery disease, depression, recurrent infections, and dental problems. Again, teeth being bones, vitamin D helps with bones. Big thing there. So, big hot spot, multiple sclerosis. It's one of those conditions for me that really frightens me, to be honest. There's still so much that seems to be unknown about this condition out there. But from a functional medicine point of view, there seems to be so much that we can do and we should be doing. And one of those things is vitamin D. In a study in 2004 in the Journal of Neurology, they indicated that women who get doses of vitamin D of at least 400 units a day have a 40% less chance of developing multiple sclerosis as opposed to those women who don't supplement anything. So are you getting enough just as the baseline can make a huge difference in your body's ability to function, especially with something like multiple sclerosis. Cancer, as well as heart attack rates are pretty much half if you're getting enough vitamin D, and they're showing more evidence along these lines. So there's recent evidence that's showing that increased vitamin D in your body can decrease your risks. Cancer. Researchers have shown that having enough vitamin D can help cut cancer and heart attack rates in half. If you're looking at countries with people who do have enough vitamin D, either through diet or through their sun exposure, they have half the rates that we do of a lot of these conditions. So they're showing that low levels of vitamin D are actually increasing someone's risk of cancers of the breast, colon, prostate, ovaries, esophagus, and lymphatic system. So all of those areas being potential high risk. So in a journal article in the American Medical Association in 2003, so again, this stuff has been out there for years, and we're just really kind of getting in there and digging into it now. They took 3,000 veterans and they looked at, again, their vitamin D intake and getting 640 units a day along with 4 grams of fiber had another, again, 40% reduction of their risk of developing precancerous colon polyps. So if you have a family history of having colon cancer, vitamin D is really something you should probably look into adding into your daily regime. And again, we talked earlier about how vitamin D is a big player in how cells regulate and how quickly they divide. So cancer cells reproduce too quickly. So if you have something like vitamin D that's helping to regulate how quickly cells do divide, it's going to interrupt that process just that much more efficiently in your body. Seasonal illnesses. So things like the common cold that you just kind of seem to see a whole lot more of certain times of the year, those also tend to be the certain times of the year when we don't get as much sun exposure and therefore that vitamin D if we're not supplementing it every day or getting enough in our diet. William Grant, who directs the Sunshine Nutrition and Health Research Center, was looking at a group of people in San Francisco and looking at how the vitamin D actually combats both bacterial and viral infections. So again, your common cold, the flu, anything where your body is actively fighting an invader. And it does show a big link to things like viral infections, again, the flu, bronchitis, and gastroenteritis. So again, those guts, when you have that disrupted gut, the immune system in your gut also needs vitamin D just as much as your respiratory tract. Type 2 diabetes. In 2006, in the Journal of Progressive Biophysics and Molecular Biology, it's shown that young and elderly adults who have lower vitamin D levels, there is a relationship with how high their blood glucose levels are and how well their body actually uses insulin, because vitamin D stimulates the pancreas to make more insulin. So if you're vitamin D deficient, the pancreas is having a harder time making that insulin. So again, if you're someone who's borderline diabetes or has diabetes and would like to help improve how well your body is able to manage your sugars, this again, something you might want to take a look at. Rheumatoid arthritis. And again, it's funny how rheumatoid arthritis tends to get worse in the winter. Again, looking at the vitamin D, everyone's like, oh, it's so worse in the cold. Cold might have a component of it, but so does the lack of vitamin D that we tend to get that time of the year. William Grant, out of the Sunshine Nutrition and Research Center down in San Francisco, because there's so much sun down in San Francisco, but apparently still enough of a deficit, where they were seeing that there was a link to low levels of vitamin D to rheumatoid arthritis, asthma, psoriasis, which is something I suffer from and have actually since my teens, and I can say from experience, it gets worse in the winter. It really does, and so it's something I can absolutely speak to from experience. So things like psoriasis and other infectious diseases, something to think about. Here's a surprising one, and this one actually might drive home, if none of the others do, but Alzheimer's and dementia. There's been a link to people who have any kind of cognitive delay, anywhere from mild cognitive delay, like, hey, where did I put my keys? Or, oh, you can't word finding, you can't finish that sentence off, you forget kind of that direction while you walked into a room, all the way up to full-blown dementia. And they were able to actually show that there is a relationship between people having cognitive deficits and their vitamin D levels. So again, going back to that neuromuscular, how well your body is able to communicate along its nerves. Let's talk a little bit about, so now that we know all the different areas that seem to be related to kind of a deficit, where can we start filling in a little bit with our vitamin D? So vitamin D in foods. So a lot of the time we kind of get overlooked. Vitamin D is high in things like salmon, sardines, a lot of sea animals, or sea creatures. The other thing too is eggs and cheese. A lot of dairy in those senses will have vitamin D, again, naturally. I will talk about fortified vitamin D in a second. But even in like a 3-ounce piece of salmon, you're still only getting 425, which again, if you're not getting anything from anywhere else, this is great. This is how, for years and years, like the natives to North America, like far, the Aboriginals, they were covered up. They have winter for like 6 months a year where they don't see the sun. The sun's actually not even out if you go high enough north for several months of the year. And they were able to maintain their levels of vitamin D with things like salmon. Looking at that, but again, even something like an egg, it's only got 25 international units in it. So you're gonna have to eat a whole lot of eggs, or every day you're having a piece of salmon, if we're not looking at where else we can get that into your body. The biggest thing and the most efficient one is the sun. And I know there's a lot of controversy around skin cancer, but at the same time, you don't need to be spending hours outside in the sun. To be honest, it's just a matter of having good exposure, and you can tell, like, me and sun. This is me after being back from a vacation. But things that will impede its ability to actually absorb into your skin would be things like clothing. The more adipose tissue, the more fat tissue you have, the harder it is for your body to absorb vitamin D. Any sunscreen, obviously, is not going to allow for that vitamin to get through. So what we recommend for most Caucasian, spending a half an hour in the sun just in a bathing suit will actually get you 50,000 units, but it's in a safe form. It's the way your body really needs it. So this isn't supplementation. This is how much that your body really can get from the sun and use naturally. If you have darker skin, it takes a little longer just because of the skin pigment in your body. It blocks some of those UVs from coming through. So it takes a little longer, in the sun, unprotected. So how much time do you really need? Anywhere from 5 to 10 minutes, 2 to 3 times a week. Again, in the winter, that gets a little more challenging. So when I try to take my dog out for a walk every day, I'm out there, my face at least gets it, my neck usually gets it, or try to get your arms out there, trying to get that vitamin D in as much as you possibly can. And in the summer, if you're going out and you're going to spend an afternoon in the park, first 10 minutes, no sunscreen. Just spend a little bit. You're not going to get, I won't even burn in about 10 minutes in just sun. And then go into the shade, slather up, and then go and enjoy the rest of the afternoon covered up. But to get that benefit from the sun, you need to give it a little bit of time without anything blocking it. Let's talk about supplements. This is where a lot of people will go to. And I just want to make sure that when you're looking at a vitamin D supplement, you understand that they're not all created the same. So there's two different forms of vitamin D that's delivered in supplementation. There's D2 and D3. D2 is a plant-based form of vitamin D, and it's the one that usually ends up in the fortified cereals and milks and grains and things like that. Our body doesn't absorb it exceptionally well. What it does absorb well is the form vitamin D3. So that's actually the best form. It's already activated. Our bodies are going to absorb it and use it just that much more efficiently. So again, if you're going to be picking out a supplement, that's something great that we do at the Rowan Health and Wellness. We'll recommend based on what your needs are. But if you're going to go out and start supplementing right away, I would go with a D3 and try to also get something that has a combination of D3 and K2. Again, it will help with that efficiency. If you can't get enough sun, how much should you actually be taking? So right now, the recommended guidelines that are out there are 400 international units a day. But that being said, if you are on that lower end and you're really deficient, that 400 is really not going to bring your body up to the point where it needs. And if you're already in the midst of infections, a cancer diagnosis, diabetes, heart disease, all of that, you might need extra in order for your body to catch up. There are risks with having too much vitamin D. I would recommend you can go and have your vitamin D tested easily with a blood test. So asking your family doctor, naturopath, or again, the Rowan Health and Wellness Clinic. It's a big thing that we do is test your vitamin D, and then we can prescribe it in those higher doses when you need it, for as long as you need it until your body is able to efficiently use it better, and we can bring the dose down. If you are going to your family doctor and you are getting tested and they're recommending you take a higher dose for a period of time and it's just not working, the other thing too is sometimes vitamin D needs magnesium as well. So if you don't have enough magnesium in your body, the vitamin D, again, it's not going to go where it needs efficiently and into your cells where it has to go. So sometimes if you're trying to substitute with that, you might have to go with a little bit of magnesium as well. I myself need to also substitute. I take an additional magnesium every day as well as my vitamin D through the winter. That's a big thing to keep in mind as well. So just that last little piece of information. And on that note, I thank you guys for joining me yet again, and I hope you health and happiness.